That was a great report. Thanks to Sheikh Al-Anizi, our voiceover. And now let's welcome Dr. Selma Alqattan, CEO. So, Dr. Selma, welcome to Good Morning Kuwait.
Hello, Miriam, and thank you for having me.
Well, it's our pleasure. As you know, you just created a new concept, so we need to talk about it. What is the scope of board certified emergency physician?
So emergency physicians, this is actually a degree. It's 4 to 5 years after you finish medical school. And it focuses on what we call the most interesting 15 minutes of every specialty. These are a group of physicians that have studied emergency medicine in every specialty, whether it's medicine, surgery, pediatrics, obstetrics and gynecology. So they see all these cases, and they cover the most critical hours, which we call the golden hours of emergency care.
So they set the call, or they are the one who say, this patient need urgent, let's say urgent care, or it goes up to priority. So who gets priority as an emergency? We know we have two patients, one got in car accident and the other, let's say, cut his hand. So how can you evaluate this is a priority and this one can wait?
A great question. So the keystone in every emergency care is what we call triaging. In Kuwait here, we use or utilize the Canadian triage assessment scale, which is also called CTAS. And we train our nurses that when any case comes, they can manage a case and they triage them from 1 to 5. 1 being the most critical and 5 being what we call cold cases, which is somebody that can potentially wait. And this triage is based on a multiple of parameters, which includes their vital signs like blood pressure, heart rate. It includes what they're presenting with. So for example, are they coming with pain versus are they seizing? Are they unconscious? Based on these, they classify 1 to 5, and that's how we see the patient.
Well, that's interesting. So we know that we have a concept, say it is an enhanced patient journey. What does that mean?
Okay, so we do know that we have to put patients first in every speciality in medicine. But now there is a concept that we have to provide an enhanced patient journey, which means basically it's not just having medical excellence, but also making sure that the full journey is up to standards. Let me give you an example. So 20, 30, 40 years ago, a patient would go to the best doctor based on their reputation,
number of patients, and other factors.
Exactly, and based on their qualifications. What if I told you this patient needed, for some reason, to see that physician maybe 3 times a week? And every time they go to that doctor, who's the best doctor in their field, they had to wait 3-4 hours in the waiting room. The waiting room would be very cold. The patient, maybe by their diagnosis, they cannot sit comfortably on a chair. And maybe they needed caregivers. So this is not an enhanced patient journey. You have to minimize the time for the patient and make that journey as pleasant as possible in addition to medical excellence.
Well, that's amazing. That is a very important topic. As you know, that here in Kuwait, especially in the governmental sector or hospitals, we suffer from the long waiting. So the seats, so Ministry of Health, the seats are not comfortable, not in any hospital. And the waiting list and journey, for example, if my appointment is, let's say, 9:30, I would see the doctor at 11 at best time. So the enhanced patient journey here in Kuwait, especially in the governmental sector, is not that top. But also, we see that same problem in private sectors. So from your own point of view, how can we enhance that?
So enhancing it is all about studying it. We utilize something called quality improvement programs, which measures every step of the way. So how long does it take for a patient to register? How long does it take for a patient to wait in the waiting room? Has the doctor ever sat in his own waiting room or her own waiting room? So you study every step along the way. Even when you leave the patient, how long does it take you to get the prescription? Can the prescription come to you instead of you go to the prescription. So the more that
it's more like logistic process.
Absolutely.
Yeah.
But you have to study it.
Yeah. You have to move from point A to point B till you reach the final destination.
Excellent.
You need to measure every step. Okay, let's say the patient get in like 8:30 and would leave at what time? With the employees after finishing working hours? No, the patient needs to leave in a certain time.
Absolutely.
Yeah. So now you said that I can ask you any question about emergency. So how do you, the emergency room differ from urgent care?
So emergency rooms and urgent cares
Yes.
they do differ. The concept of urgent care came because with time we noticed that emergency departments are getting quite busy.
Yes.
And this is not just a local issue, this is an international issue. I can tell you that some international waiting times in emergency departments have reached 19 hours. So in Kuwait, we're actually considered pretty good and quite short in our waiting times.
Yes.
And these are international numbers, not local numbers. So urgent care actually kept the standard of excellence, the healthcare excellence, but tried to minimize the time and tried even their locations by definition as being within the community. So they're closer to patients.
Yes.
Especially if you have a place, for example, that is potentially a place of gathering, mass gatherings, so something like a mall, a resort, so you're closer to the patient.
Yes, this is my next question. Based on your experience, do you think that we need to add, or the Ministry of Health need to establish urgent care centers or units close to, let's say, highly dense populated areas, like in malls, souks, or in any active place? You know that we are heading to the camping season. So to get from, let's say, a camping accident in northern Kuwait till reaching Jaha Hospital, it would take time, at least 30 minutes. But these 30 minutes are vital. So do you think that the Ministry of Health need to establish these kind of centers?
I think Kuwait, we have a very good advantage that we're actually a very small country geographically.
Exactly, yes.
So potentially things are very close. However, if you even have, whether it's mass gatherings or even something like a sporting event,
Yes.
A lot of the paramedics, even by law, have to be at close proximity to a sporting event.
Yes.
Whether it's, for example, what we saw earlier with the boats. So by law, there has to be a point of healthcare over there that they cover. The same thing if there was a concert, for example. So this is happening at the moment. The points that we see in paramedics, it is first responder care, and then they would transfer them to the closest hospital.
Well, that's amazing. And final question, do you think that this kind of, let's say, medical knowledge need to be established in schools? Teachers, faculty members need to learn these basic steps.
Absolutely. I think time is health, and the faster the intervention, the more life-saving it is. Some situations in healthcare, you have seconds to interact, or minutes. Something like choking, for example, seizing.
It's vital,
Absolutely. So I think everybody should have basic healthcare training to be able to support at least their loved ones. Places of mass gathering, I would absolutely recommend that there was some sort of medical specialist to support.
Well, that's interesting, and we hope that the Ministry of Health, also the Ministry of Education, would establish and start these kind of trainings and centers just to make sure the safety of everyone around the event or in the event. So once again, thank you for joining us, Dr. Selma, and good morning, Kuwait. We wish you all the best.
It was a pleasure. Thank you very much.
Well, we need to take a break right now, and then we're going to come to the end, so stay tuned.